Now we'll have our next presenter, Dr. HEMA, who is a vitreoretinal fellow at Compressed Eye Hospital. She's an alumni of Aravind Eye Hospital, and she'll be guiding you about how to plan and pursue fellowship.
Good morning all. I thank Dr. Raki for this opportunity. I don't have any financial interest or personal interest on this presentation. So when you are doing comprehensive ophthalmology, or when you are a general ophthalmologist, you feel that you have a variety of pathology to be seen every day. You can practice anywhere or you can earn sooner. So the question arises whether you really want a fellowship. So my suggestion is that the earning sooner is the only thing left for our generation. Variety of pathologies and practice anywhere was for our previous generation 10 to 15 years back. So for me, whether a fellowship is needed or not, yes, it is a big fat yes, you need a fellowship. And sooner the better. And as Vaishagi has already discussed, when you're planning for a fellowship, the best 3 things you need is an attitude which can cope up with the stress you are going to face in the institution. And the second thing is the feasibility. Feasibility means you have to see where you are going to settle. If you are going to settle in a small town where there is no provision for an eye bank, you can't be specialized in keratoplasty and go and practice there. The same thing happens when you want to be a vitreoretinal surgeon and you don't have a setup or an OT for a vitreoretinal surgery. You can't take a VR fellowship and go and work there. So always look for the place where you're planning to settle. And as we have discussed, for us, especially females, we need a support system. And for us, mostly it will be house help or our parents. So when we start the fellowship journey, we'll see for the announcement of dates, we need a curriculum vitae. We should write a test which can be preliminary, or we'll have to write a final test also. And the last thing is the interview. I am here no one to suggest which specialty is best for you. That you have to search for yourself. But what I can suggest is that the specialty should be the one which you are passionate about. Don't get fascinated by the great videos you see in YouTubes or in conferences, the heroic surgeries which are done by the stalwarts in the specialty. Be practical and also see the feasibility in your place. So how to decide on the institute? You can discuss with the alumni of that institute, but how to get withhold to them is that in that case, these conferences and all helps us, and social medias. In conferences, you can meet people and you can have friendly contacts with them. And also through your seniors who are working in this institute, you can have a discussion with the alumni. So what should you discuss? You should always discuss about the clinical exposure. The present protocol means when you are doing a fellowship for 3 years, sometimes the 3 years is not dedicated to the specialty alone. The first or second year, there'll be a general period, and you may get a specialty training only in the last year. So that depends from each institution. So you have to discuss what's happening in the protocol. Like some institute like LVPA, first 1.5 years you'll be sent to a peripheral centers, and the later 1.5 years you'll be getting an exposure to the specialty. This is very good in cases of an anterior segment surgeon, because in peripheral centers you'll get to do all the cases like cataract, DCR surgeries, etc. So you will have a very good hand on phaco. But when you ask me for a posterior surgeon, 1.5 year training is very less. So always decide on the institute, their protocols. And also bond. Supreme institutes have their bond. And extended fellowship means in many institutes you can stay back for 1 or 2 years and you can increase your surgical exposure. How to apply? As we all know, we can search in the Google like this. AIOC are providing fellowship programs from each institute. You can click on the institute and they will show you the curriculum, the catalog. In the catalog, they'll be having the places, their branches, duration of the course, and also whom to contact. But again, this changes from year to year. You have to be updated about the catalog sometimes this may be updated 2 or 3 years back. So you should contact directly into the institute and also make sure that the duration and the position per year are the same. Or else what you can do is you can go to the site of the institute and you can search for the dates of announcement of the exams, etc. So to say is that most of the institute they'll be having 1 or 2 admissions per year for a specialty, and the number of seats varies. So you should be prepared 3 or 4 months before the induction course. Suppose the induction course starts in Jan, you should apply in September or October. If it starts in June, you have to start applying in March or April. So be prepared with your plan 6 months before the completion of course. That is, as soon as you are going to finish your theory exam, you should be ready with your plan for fellowship. The first thing is preparing a curriculum vitae. We know how to prepare the curriculum vitae, but we have to remember that it shouldn't be fancy. What they are looking is, should they take you or should they choose you to their institute? Stop writing like this hardworking, motivated, blah, blah, blah. No one is going to believe you. They know what you are. You have to work and prove. And research and publication, you should have a thorough knowledge about the topic you have written or published. If you don't have a publication, if you have in your PG time, it's okay. You can present your thesis, and you can, but you should know in and out of your thesis. The conference and presentations presented, conferences in graduation and undergraduation you can tell, but when you're telling a presentation, you should be prepared for the questions also. Sometimes the interviewer himself would have come for the presentation and he would have presented. So just don't blabber, you should know what you have attended and the topic also. When writing the references, don't write references of your friends or batchmates. Write a senior member who is your mentor or teacher. He should be able to vouch on your character. Preferably someone who is known to the panel. Your seniors or consultant will be having friends in the institute, so you can write their name as the reference. And also expect a double check. The institute may call this fellow and they are going to ask. So you inform the referees also that you have given his name as the reference. About the extracurricular activities, all of us take this lightly when we are writing a curriculum. Just don't write like listening to music, watching TV, etc. Be specific. Write a band name or a cricket team or any sports team name. What it helps is that it helps you to initiate a conversation with the panelists. The panelists may be interested in that band or a cricket team. So they will like notice you that this, when they make the final list, your name can be projected so that they have noticed this person by this band name or cricket team. So even writing the extracurricular activities in the curriculum vitae is important. So fellowship exams, some institute has preliminary, some has both preliminary and final. Institute like LVPA gives the study material. We have to study that and we have to write the exam. Questions will be from the general ophthalmology, all the specialties, and also from the specialties pertaining. So both you have to read, not only the specialties. And the tiebreaker is recent advances in the specialty and studies by the institute. If you are going to write an exam by AIMS, you have to know what are the studies done by the AIMS, because there is a chance that they ask the questions from that area. For interview, you know the dress code, no need to discuss. Better to both these dresses you can't wear. Better to have a formal dress both for males and females. And in interview, no one is going to judge your knowledge, because if you have a knowledge, you are not going for a fellowship. They know. They are seeing the attitudes. They will ask the questions like, why this institute? Why this specialty? And they also see the choice of specialty. So most people write 2 or 3 choices of specialty, but it's not useful. You should write at maximum 2. Try to stick on one specialty. Don't write 3 or 4 specialty, because then the examiner will judge you like this person has no particular aim. They have just come for a exam or interview like that. So better stick on a specialty always. Always have a ground check on your institute. You should know the history of your institute, which you are going to, about the faculty members and the board of interviewers. You can ask the people or PGs from there, because most of the time the interviewer panel will be the same. And the body of work of the institute you should always know, especially in that specialty. They may also ask questions like problem solving and teamwork questions. They may ask like, one of your co-worker has done, you were doing in the other table and one of your co-fellow was doing something and some mistake happened, what you will do? Then you will have to answer, thinking and answer. What they're expecting is your attitude towards the problem. Like, are you ready to work as a team? Are you ready to help? Also, if you have done something wrong, like you have instilled some drops, or the sister has instilled, when you are working, especially in the peripheral centers, you will have to take care of everything, like the sisters, the accounts, everything you will have to take care of, especially in prime institutes. So they will see whether you are ready to discuss this with the authorities. If something mistake happens, you should admit that to authorities, report to that authorities. Also, your mentality to work as a team. And they'll ask about the future plans, the long-term future plans, where you are going to settle, your kids, your marriage, and also what you are planning for the bond, and whether you are trying to stick on to the extended fellowship commitment, etc. So if you have any commitment back home or family to take care of, be honest and discuss. So likewise, we can start a fellowship. Thank you.
Thank you, Dr. Hema. That was indeed an extensive and detailed description about how to prepare for a fellowship and how to plan. Actually, this might be a question among some of the residents, because does it actually matter where you did your residency? Because anywhere you have done, actually your knowledge and passion matters. Wherever you have done, you can gain whatever knowledge and you can have your passion. But does it actually matter when it comes to the fellowship interviews?
I can't say no to that, because the people who has done PGs in that institute will have an upper hand. But on the other hand, they will also see the attitude of the contestant. Even if you have done from a small town, as I have told, you have done a good groundwork of the subject and the institute, and you have shown the passion on how you'll be working on the subject, they'll be happy. I think they'll take the interview is what all matters than the institute where you have done the PG. So be prepared for the subspecialty questions in the interview, especially when they ask about the their works. They are anyway going to ask questions on their work in the subspecialty. So have a knowledge on that. That you can go through the interviewer, you can know the panelist and go through the works done by the panelist especially, and you can talk about that. Also be passionate about whatever work you have done, even if it is a small work you have done at an institute, that also matters. So interview is the one that matters, that also will matter, not only the institute where you have done the PG. And Vaishak is the one who recently has undergone a fellowship from Shroff. So can you discuss what was the interview and the entrance pattern in Shroff Hospital?
Actually, Shroff is very good institute for actually all subspecialties, and currently I am pursuing in pediatric ophthalmology there. So there also the interview, actually the thing is, actually what matters is they will have any way to assess your knowledge. There was an MCQ of like 50 questions, and after that there was interview where they had actually asked 3-4 like particular subspecialty questions. And actually also sometimes it matter, because they'll also check what you have done previously, how much surgery you have done, and when ultimately it's your knowledge which matters, they will take into account if you have done enough surgeries and all. They will prefer such candidates, like because they know you are already like okay with your like SICS and like FACO and all. If they think you are okay with that, they'll prefer to select you. That they will have actually it's a prejudice also, because they'll think like you can move further to your like subspecialty surgeries and all. So that is a like small glitch there, but ultimately what they measure is based on that MCQ and interview questions only.
But they can't take all seats from the premium institute, right?
Yeah,
there'll be so many seats, right?
It's there, and but I was just telling like that plays a role maybe.
Yeah.
It's also depend on the interviewer also.